cold. Oh, good, thank you. There's a new girl at the ice cream store. She doesn't seem too fond of buttoning her top button. Let's go check her out.
When a person faints, it's because they're not getting enough blood to their brain. The act of falling corrects the problem. You faint again, strapped into that power chair where you can't fall. You might not wake up.
Killed by an assistive device. At least my death would be ironic.
I think when you went to Thailand, you picked up a threadworm called strongyloides. They usually go up through your feet.
I didn't do a lot of walking on the beach.
But I assume you did have someone lay you down in the sand. Bare back, bare legs, increases exposure tenfold over bare feet. 2 pills. You'll be all better.
Can I have some water for those, please?
Hey, take a number.
I just didn't say anything about taking turns. What you testing you for?
Don't. They'll spend all day obsessing over my idea instead of coming up with one of their own. And hey, I might be wrong.
Seriously, I'm worried that if we don't know what she's giving you, there could be conflicts.
No, you're not. House told me he's keeping track of all that. 10 doctors, they should be getting 10 cures.
We need blood, hair, and stool. You poop, and then you use the wooden sticks to collect the fecal matter, and then you rub it on the green box.
Hand it to my dog. Only one of those things I could do on my own in the last couple of days. I haven't been doing that. Ow.
Is it all right with you if we carry you into the bathroom?
If you want me there, that's the way you're gonna have to do it.
Okay. Ready?
Mm-hmm.
1, 2, 3.
Can I get a little head support, please? Thank you.
It's called xenodiagnosis. We let these bugs bite you, and then we test their feces for parasites.
Why can't you test my feces?
Because you've been chugging milk and magnesia for the past hour. You got a lot going in and nothing coming out.
Testing the bug's feces is actually more accurate than testing yours. Smaller haystack, easier to find the needle.
You okay? Get the bugs off him. Get the bugs off him!
Test isn't done.
He's choking.
Blood pressure's remaining stable through 60 degrees.
No pauses on his EKG, no nausea. No treatment worked.
I need our patient.
I think if he's cured, Amber, it's over.
You obviously haven't stressed the system hard enough.
You crank it up high enough, anyone will pass out.
This is incredible. This is the most I've moved in 20 years. Guess you didn't find your tumor?
The other doctors tell you that you were fine.
Yeah. In a sense, it's just my disease getting worse. You come to terms with this disease. You know it's there. You know it's waiting. And every now and again, take something away. Took my walking. Took my modesty. Now it's taking one of my last pleasures.
There's an outside shot. It's something other than the SMA is causing your eating problems. And if it is, we can fix it. Remove that tube.
Is that my blood? It's green. What does that mean?
It means I'm not fired.
I thought melanoma was skin cancer.
Technically, it's cancer of the pigment cells, the same cells that give your iris its color.
Cancer. Why not? What else can God throw at me?
Hail, locusts, smiting of the firstborn. First, it all depends on how evil you've been.
House.
If it's cancer, it's spread everywhere, right? That's what's in my lungs, my kidneys.
There is a chance by removing the eye, get the primary tumor, and 3 courses of radiation, that could...
Could? What? A few months? Years?
More likely months.
Any of your other doctors have any cheerier diagnoses?
If they do, they're wrong. This is the answer. It's the only way to help you.
I already can't walk. I can't eat. You telling me that the rest of my life is in this bed, puking in pain?
We can manage the pain.
I'd rather just get this over with. I've been trapped in this useless body long enough. It'd be nice to finally get out.
Get out and go where? You think you're gonna sprout wings and start flying around with the other angels? Don't be an idiot. There is no after. There's just this.
House!
You're not getting enough oxygen, so we're inserting a tube directly into your lungs. It should help us drain some of this excess fluid.
Should make you a little more comfortable.
Sats are still dropping.
Fluid's clear. If this was cancer, there should be blood. Call house.
He just paged me.
How fast will this work?
New med should start helping in minutes. Okay, hang in there.
Accutainer's full. I need to replace it.
I don't think it's working.
Try and relax.
You must be wrong.
Stop talking. Hurry up and get the chest tube working.
Okay, I got it.
Can you get Hoover? I can't. Can you put my hand on his head? It's okay. Don't worry. I'm not scared.
Oh, God.
What did we miss?
If we knew, he wouldn't be dead.
That's it? You're just gonna give up?
No, we were defeated. It's over.
Patient presented with syncope. We thought it was threadworms, gave him ivermectin.
Thank you. Patient seemed better until his blood turned green.
Can we at least remove the body before launching into a purely academic exercise?
The patient didn't respond to antibiotics or steroids.
You okay, boy?
What's wrong with the dog?
He's dead. There are only a handful of viruses that can cross between dogs and humans, but they may not be connected at all. The dog was old. I've seen it before. They hang on way past their normal life expectancy to take care of their masters.
Did you watch him take the pills? The ivermectin, did you watch the patient put them in his mouth and swallow them?
I don't know. I think so.
What kind of dog is that?
English Shepherd.
It's in the collie family, right?
Not really.
They share the MDR1 gene.
Yeah.
What happens when you give a dog with the MDR1 gene ivermectin?
They don't. I mean, it's used to treat heartworms in most dogs, but it'd be fatal if the...
Look familiar? I think the last time you saw it, it didn't have that dead dog's teeth marks on it.
I just put it on the bed tray to get him some water.
When I asked you if you watched the patient swallow the pills, the right answer was no. Take his body down to the morgue.
Promise me that you will save her first.
How are you? Luna, say hi to your mom.
Give me a clue, anything.
The report's missing. Somebody tore it out.
Look, I know this isn't where your head's at right now, but you need to call your union rep. Police are gonna have questions, and you need to be protected.
I was carrying Whitaker in. People were looking at me like I killed.
Don't.
I need to be fired, Lauren. The police should put me in jail.
Robert, you drive an ambulance. There's not a single human being who's needed one who wished the driver had gone slower.
Tell that to the man's family. I met his wife, his grandson.
Okay, listen to me. Two of the best doctors at this hospital are doing everything they can for him right now. And Whitaker is gonna pull through. Because that's our job. And your job is to stop blaming yourself. Okay? Another car cut you off. This is not your fault.
I was in the car, Lauren. I got around the car. It was me. I was going too fast. This was all me.
We did all we could. He's gone.
Right. I understand. Thank you. Where's Moreland?
He's waiting to talk to the police.
Well, he's gonna talk to me first.
Max, you understand this isn't his fault, right? He's one of us. Max.
Where's the dispatch report, Rob?
It should be in the ambulance?
Yeah, should be, but it isn't because someone tore it out.
Okay, look, anything you want from the report, you can get from 911 dispatch.
I just called 911 dispatch, and the patient that he picked up, Mr. Santangelo, who is now dead, didn't call 911. He called the non-emergency line because he had a fever and his wife was concerned. The man didn't even need an ambulance. That's why you took this report, isn't it? You were driving like a madman with a non-emergent patient whom you knew had no business being in your vehicle. Keep it, or give it to the cops. I'm sure they want to read it. So, what's the emergency?
Mr. Santangelo lived on the Upper East Side.
What were you doing 40 blocks outside the hospital jurisdiction? Is that why you were driving so fast, is to make up the miles?
This is me now, Rob. Not the police. And you need to tell me why this happened.
We were ordered to make the pickup.
What? Ordered by who?
Our battalion chief.
Why? Why were you driving 1,000 miles an hour for a man with a fever?
Hey, look. We were told to ignore jurisdiction. Grab any patient we could anywhere in the city, then drive bat out of hell to make the drop so we can get back out onto the street as soon as possible.
That's insane. Why would he tell you to do that?
Private ambulance companies are killing us, Lauren. This is how you compete.
Your chief? He's done.
Wasn't his idea.
Oh, yeah? Then whose was it?
Dr. Fuentes, your new medical director.
Kayla presented to the clinic with multiple joint and stomach pain. Dr. Foreman was called in for a neurological consult.
What's the point of this, man?
Checking your sister's cerebral coordination.
The thing is in her leg and her stomach. Wait in the clinic for 6 hours so she can play patty cake.
Could have gone to the ER last night.
Oh, yeah. You gonna come over and babysit her kids?
Any pain? Is it bad? This will go a lot easier if you talk to me.
I'm sorry. I just really hate hospitals.
When I was 12, had my tonsils out, got to skip school, lots of ice cream, made me want to be a doctor.
My mom died when I was 8, so I spent months at Princeton General.
She died of DTs, your mom? Bottles stashed around the house, mood swings, that whole deal?
You've been there?
My mom. Dad left, Mum crawled inside a bottle. Made for a great year 12 of high school.
You okay with your dad now?
No.
Dr. Chase? Hi.
Hi.
Kayla, I'm here for the test. My arm.
Oh, yeah. Okay. It's positive. Talk to Nurse Trevin, get an appointment with Dr. Broston in rheumatology.
I took that medicine you gave me, but my stomach still hurts.
Sheds could be stronger than we thought, or it could be reflux from the prednisone. Is it stronger antacid?
Doctor.
Yes.
Nothing.
I'm in the stomach. There's too much blood, I can't see.
She burst an artery?
No. There. Bubbling. Just a bad ulcer. Okay. Cauterizing. Looks good. Bleeding ulcer. We got it. She was fine 2 hours ago.
If by fine, you mean she had fountains of blood spurting out of every orifice, then yeah, I believe you. I'm guessing those are celebratory bells.
Solid BP 70.
Show me the ulcer.
It's brown. I cauterized it.
Sweet back. Show me the whole stomach. Stop.
Second ulcer?
Not anymore. It perforated.
Get into an OR.
Let's go.
She was not fine 2 hours ago. She mentioned stomach pain?
Yeah, so I gave her a stronger...
You didn't do an exam.
She just came in for a follow-up. The results of the pathogen test.
Did you listen to her stomach? Check her vitals?
Maybe if she'd said something about taking ibuprofen, mentioned the rectal bleeding.
Yeah! Why didn't she go to med school like you did? Diarrhea, blood in the stool. These are routine questions.
The doctors skip all the time. It was a minor mistake. I couldn't have known it was gonna
Mistakes
happen.
are as serious as the results they cause. This woman could die because you were too lazy to ask one simple question.
No, she might die because I had the bad luck to spill your damn Vicodin pills.
The kidney damage isn't so bad. The liver damage is more worrisome. There's no dialysis for livers.
I know, but if she loses a liver, she can get a transplant, right?
We can put her on a list.
I could do it. I could give her part of my liver.
Surgeons won't operate unless the donor's had a long time to weigh the decision.
There's black markets.
For organs, that's just... Oh, my stomach.
Pain constant?
Oh, yeah.
Sharp or dull?
Oh, I don't know.
It's firm.
A little cold. She's got ascites.
No, it's a clot.
Nurse, call the OR. We got a pepper for embolectomy.
CBC, PT, and liver panel.
Is she next on the list?
Yes.
But she's AB negative. Very rare.
How long could she go on like this?
Probably another day or two.
I'm donating my liver.
Sam, we've talked about this.
I'm a perfect match. 6 out of 6 HLA proteins.
How'd you get checked out so fast?
I know a guy in medical testing, and I paid him to rush it.
Because Sam had rushed his tests, we were able to get them into surgery that afternoon. Dr. Ayersman performed a live donor transplant. He resected the right lobe, hepatic vein, and hepatic artery of Sam's liver and transplanted it into Kayla. The operation was a success. Kayla and Sam continued to receive routine care. How are the girls?
They're great. Dory had her first crush, which was cute.
Oh, yeah?
And then her first sort of breakup, which was not so cute.
You're hot. 99.3. You been coughing?
No.
Pain in urinating?
No. 99's not that high, is it?
Immunosuppressants block fevers. You shouldn't have one at all. I'm sending a nurse in here to draw cultures. And I'm ordering chest x-ray. We need to talk.
No, there's no time.
2 minutes. Kayla, I made a mistake. I wasn't as blunt as I should have been at Bashir Hamed's. I probably didn't want to face him myself.
Dr. Chase, please don't do this.
Stress of the travel, the operation, even then, the cancer.
Kayla, we are going.
My dad died. Lung cancer. I saw him a couple of months before it happened. We never talked about it.
I'm sorry your father died, but it has nothing
He
to
even
do...
told me he was sick. I wish he had. It would... You're gonna die. Alone. Thousands of miles from your children. You don't want to do that to them.
Kayla.
I'm sorry, Sam.
Kayla, you can't give up. If you do this, if you go home, I killed you.
No. You gave me 3 months. You gave Dory and Nikki 3 more months with me. And when they found my cancer, they found yours. And I got to save my baby brother.
Incoming! 35-year-old male found down in his kitchen. Hypotensive at 80/40, rate 134, only responsive to pain.
All right, you're going to treatment for Dr. Rose. Can you get this, please? We're slammed.
I'm on it, Reese. Come with me. Ready? 1, 2, 3.
All right, let's get him hooked up. Prep a saline line. We're gonna need another one wide open.
O2 sats are 85 and dropping.
What's happening to me? We're gonna find that out. We're gonna intubate. Give me a 7.5 ET tube, 20 of etomidate, and 1 milligram per kilo of rock.
Septic shock?
Maybe, but we need to find a source. Your respiratory muscles are weak. I'm gonna intubate you so that they can rest. Give them 3 grams of Unison. Send for a CBC, CMP, coags, and lactate. Give me a blood gas and blood and urine for culture.
On it.
There's no bleeding or deformity in his legs.
We're almost ready. Heart rate is erratic. Watch his pressure.
All right, I am in.
Dr. Rhodes?
O2 sats are 98 and he's stable.
No. We need to get him up to the OR now. I have a feeling we're already too late.
Patient's spouse is here. He's very anxious. Any updates I can give him?
Tell him his husband's got necrotizing fasciitis and we're debriding the muscle to try and stop the infection.
Dr. Rhodes, is that okay?
Yeah, that's fine.
Did a med student seriously just go over my head to you?
Is Dr. Unger coming back?
Dr. Unger? I don't know. Was he...
He was starting to explain things, but his office kept paging him, so he had to go.
Oh.
But it sounded bad.
Necrotizing fasciitis is what people call flesh-eating bacteria, but that's a misnomer. It doesn't actually eat. It just spreads very quickly. Even with surgery and antibiotics, once it starts moving, we hardly ever catch up.
That's what Dr. Unger was saying.
Is he Elias's regular doctor?
Yeah. I mean, not regular. He hardly ever went. Monday was the first time he'd been in, like, 2 years.
He saw Dr. Unger 2 days ago?
Yeah. He had a pimple on his arm that was bugging him.
And what did Dr. Unger do?
He didn't think it was anything to worry about. I mean, it was just a pimple. It hurt him more yesterday, so we called. But we never heard back. I guess it wasn't just a pimple.
No. Do you know a doctor in private practice named Unger?
Yeah.
Is he reputable?
Why?
He missed a diagnosis, and now that patient's probably going to die.
Truthfully, he's missed a few in the last few months.
Can you pull up the list of his patients who've been here recently? April.
Okay, just keep my name out of it. You didn't get this from me.
Excuse me, Miss Goodwin.
What is it?
What exactly is the protocol for reporting medical misconduct?
Nurse, doctor, who?
Doctor. Dr. Unger.
Let's take this up to my office.
Over the past 2 years, Dr. Unger has increasingly missed routine diagnoses. In the past 3 months alone, there have been 4 separate incidents: a UTI that led to pyelonephritis, abdominal pain that turned into a ruptured appendix, a leg rash that turned out to be a DVT, and now an infected pimple that's led to necrotizing fasciitis.
You know this guy. What are your thoughts?
We went to medical school together. You know, he's a caring, thorough physician. Been my personal doctor for years. Never missed a thing.
He missed those. And they're only the ones that came in here.
Thank you, Reese. We'll look into it. In the meantime, don't share your concerns with anyone else.
I worry about his patients. Dr. Unger should lose his license, at the very least his hospital privileges.
That's not your call to make. Thank you.
Code blue, ICU.
Excuse me, sir. Excuse me. There's no pulse.
What's happening?
He's unresponsive.
He's in VTAC.
Cardiac arrest.
What? Elias!
Give me the paddles, charged to 200.
Charging to 200. Here.
Clear? Clear.
Nothing. Stand by.
All right, 1 milligram of epi.
Got it, milligram of epi.
1 of epi.
Elias, come on! Elias!
Again, clear. Clear.
Please, please save him. Please, please, come on, save him.
Again, clear.
Clear.
Another milligram of epi. Doctor?
Oh my God, no.
Time of death, 15:22.
No. I'm sorry, Jim. Don't touch me.
How could she be allergic to everything?
She can't be. Has to be an infection. You see a positive allergy test and decide it's infection.
Bacteria got into the scratches in her back.
Infection's radiate. The shape of this isn't.
Eat this.
I don't feel like eating.
Make you better.
A sandwich.
Magic sandwich.
There's no such
Just
thing.
take a damn bite, okay, kid? amazing how she didn't go into anaphylactic shock.
It's diagnostically ridiculous.
Right. She's allergic to everything except peanuts.
She is allergic. Antibiotics could cause a massive systemic reaction.
If she's allergic. If she's not.
Chase, you're right. The shape indicates allergy, the tests indicate allergy. Just because she's not allergic to peanuts doesn't mean she's not allergic to lidocaine or...
Chase, hang the bag. You can grow a backbone tomorrow.
He doesn't freeze my counts, I'm guilty. He does freeze my counts, I'm guilty.
Is Alice having some procedure done?
She's fine, she's resting.
Where?
In a room where you're not supposed to...
I was just at the window. There's no one in there. Her backpack wasn't there either. You don't think her father could have...
Call security. Get it, Gurney.
She's stiff. She can't move.
I don't know what happened. She seemed fine.
Let's help her, please.
Which one of you two gave her an aspirin?
What?
Her symptoms fit Reye's syndrome, which doesn't make any sense unless she took aspirin.
Rob?
No way. She's a kid. I've read the 800 warning labels.
I'm not even angry. I just want her to be okay.
She's lying. She's angry because you kidnapped her kid. She'll be angrier if the kid dies.
I didn't.
One aspirin combined with a pre-existing infection is all it takes to set off an attack.
I'm not lying.
Well, sure. You certainly earned her trust. Where was Alice the night before she came in?
With me? Well, at my house. I went out. She stayed with the babysitter.
Where were you?
None of your business.
You hired someone that might have poisoned our daughter.
She's 15. She's very responsible.
Is she a 15-year-old pharmacist? Or just some kid from down the street who needed 20 bucks for lip gloss and a couple of tiger beats? Put your kid on charcoal hemoperfusion.
Should we see what the babysitter has to say?
I know what she's gonna say. She's gonna lie to save her business.
We are going to use this machine to clean your blood. It goes out of you and through a filter, like the filter in a fish tank. It's kind of cool, actually.
I'm scared.
It won't hurt. It takes a while, so it'll be boring, but it won't hurt. It's gonna make you better.
They hate each other, don't they? Never gonna be together again.
Well, you never know. How's it going?
Boring.
Told you.
So far, so good. Just like 5 minutes ago, 10 minutes before that.
What's the matter?
Something on a clap.
Let's get her out of here. I'll call the OR.
You said it wouldn't hurt.
Found it.
She's burning up.
Give me a sec.
Foreman sheet is on fire.
Almost there.
Get you some cooling blankets now. Right away. Every time we touch this kid, something goes wrong.
Bad mojo is not a diagnosis.
Look at her arm.
I told you it was an infection.
We fixed the infection.
Well, apparently not. I asked you for broad spectrum. You put her on the bare minimum. It's a good thing you failed to become a mom because you suck at it.
Chloramphenicol isn't working.
What dose did you give her?
Yeah, maybe Chase screwed up. We always end up there, just getting a jump on it. I doubled her up.
The infection's morphed. It's moved into her muscle sheath.
Necrotizing fasciitis?
That's impervious to drugs.
The only treatment is to cut away the infected area. So we amputate.
Arm and leg? We can't cut a 6-year-old kid in half without a confirmed diagnosis.
Moves too quickly, and we waited too long. We don't have time for culture.
We can at least observe her for a few hours, confirm the rash is spreading.
If it spreads, she dies.
You're talking about crippling her.
We're not even certain this was an infection.
Right! She's sick. She's cute. She can't have flesh-eating bacteria. It's just wrong. Let's cure her with sunshine and puppies. Cute kids die of terrible illnesses. Innocent doctors go to jail. It's because cowards like you won't stand up and do what's required. You can sit around and moan about who's the bigger weakling. I'm gonna go do my job.
What kind of quality of life will she have without...
Great thing about life, it's got qualities. And if we can't agree?
I don't know.
He's yelled at us before.
Because he thought our theories were dumb, not because our theories were sending him to jail.
He's going through withdrawal. Could be causing mild paranoia. It'll pass. We just have to suffer through it.
We never ruled out allergy.
We gave her drugs. She had no negative reaction.
We cut open her belly, she got a rash on her belly. We did a scratch test on her back, she got a rash on her back. I know House ruled out mojo, but it can't be a coincidence
Little late to be playing differential games, isn't it?
Hey, get that thing away from me. I don't want to get burned.
Laser pointers don't burn, you genius.
Skin, no. Retina, yes.
You don't trust my aim? Maybe you should cover any sensitive... He was wrong about the puppies. House! Gotta stop the surgery. She doesn't have necrotizing fasciitis.
Oh, good.
She's got erythropoietic protoporphyria. She's allergic to light. It's genetic. Either parent could have carried it.
I know what it is. Infection fits better.
She gets worse every time she goes under surgical lights. Dad takes her outside.
Liver shot, too. Did she swallow a flashlight?
Stop the surgery.
Get the hell out of my way.
No, I'm... Light damages the blood cells. The damaged blood cells contain protoporphyrin. The protoporphyrin builds up in the liver. That's why the liver's shutting down.
Be allergic to light. She's never had this problem before. The negative reaction starts at birth. It reaches critical mass around this age. Her blood cells create chemicals in reaction to light. When they reach the liver, it tries to filter out the bad cells. The chemicals damage the liver, and one byproduct is gallstones.
So she'll just keep getting worse?
EP can be managed. We'll give her beta-carotene. She's gonna need special light bulbs and filters on the windows. She's probably gonna need to be homeschooled. Her life will be complicated. But she will live.
How do you get something like this?
It's genetic.
So one of us.
Both of you must be carriers. She's gonna want to see you when she wakes up, so don't screw it up.
So, how long have you had this pain?
2 days, but it's getting worse every hour.
Any other symptoms I should know about? Fever, vomiting?
Does dry heaving count?
Have you experienced these symptoms before, Miss Bennett?
Cassie, I have endometriosis, but this is way worse than normal.
Have you spoken to your OBGYN about these new symptoms?
Yes, I have, and they can't see me until next week. But the last time I saw her, she just told me to get pregnant. At least then I'd have 9 months of relief.
Right. Well, I've heard that comes with its own set of side effects. Look, the adhesions for endometriosis can cause severe pain. Unfortunately, it's a chronic issue, and there's really not too much we can do for a flare-up here in the emergency department, so.
I know. Look, and I know what you're thinking, okay? Woman with endo comes in, suffering from a flare-up, is afraid it's something worse, and it never is, and there's nothing you can do for her. Look, I have been through this more times than I can count, all right? I've been told to go home and take pain meds and sleep it off, and I have done all that. And
Are you here by yourself?
my boyfriend's out of town. Look, you're just gonna have to trust me on this, okay? I know my body, and this pain is different.
What's your story, Dr. Curtis, quickly?
Emergency walk-in. I'd like to do a lab to isolate the cause of her pain.
Endometriosis. We both know we don't do elective procedures for chronic problems.
Yes, but...
Likely having a flare-up.
I did a transvaginal ultrasound, and...
Nothing's conclusive on it.
There have been cases where imaging has missed ovarian torsion, even a ruptured cyst. Her abdomen's distended, she's in extreme pain, and I am concerned it could be more than endometriosis.
Are you? Or are you fishing for OR time?
No, I want the operative time, but that doesn't mean my patient is wrong about her pain being acute.
Dr. Curtis, endo's tricky. Women can feel one thing one day and something completely different the next. The pathophysiology of uterine nerves.
They're complex.
And often don't correspond to what's happening internally. And every time we go in there, we run the risk of doing more harm than good. Surgical intervention is not an option in the absence of extremely clear evidence, which you simply do not have here. She should follow up with her OBGYN, send them the ultrasound, otherwise give her Toradol or send her home to rest.
64-year-old female, arteriogram.
Aneurysm at 4 centimeters. Let's keep her under observation.
Miss Bennett.
You're sending me home.
Well, your imaging didn't warrant further action, but we will forward it to your OBGYN for follow-up. In the meantime, I did give you some anti-inflammatories for the pain. So if it gets any worse...
What? Come back? It's already worse. Look, please don't be like the rest of them. Don't do this.
You can take your time getting dressed. What happened?
I got 2 blocks away and threw up. You told me to come back if it got worse. They just gave me this bucket and told me to wait here. I was trying to make it to the bathroom, but I couldn't.
Come on.
I need someone to fight for me.
Okay? All right. Let's go. Dr. Singh? Dr. Singh, the endometriosis patient I brought you earlier?
I thought we sent her home.
We did, and she's back in agony. She's vomiting, she's hemorrhaging, which we both know are signs of a ruptured cyst and not just chronic endo pain. She needs surgery now.
Book an OR, stat.
And I want to stay on to see this patient through.
It's your call. If it is ruptured, it's good we caught it when we did.
It was a difficult surgery. In addition to the extensive scarring from the endometriosis, you also had a hemorrhaging ruptured cyst. And as a result of the damage, we had to remove one of your ovaries.
I lost an ovary?
Well, the good news is we got in time to save the other one. You told us that it was more serious all along, and the system's just not good at dealing with chronic pain, so.
You don't know what it's like to be dismissed and ignored. Told what you feel isn't real.
Cassie, I just wanted you to hear someone say you were right.
I know I was.
How you feeling?
That wasn't my crack pipe.
You told me. Are you tired?
I just took a hit off it a couple of times. What's wrong with having a little fun?
Your personal life is none of my business.
You don't like me, though, do you?
That's your imagination. I've seen every kind of drug abuse. No offense, but you don't even stand out of the pack.
I'm betting you got money the same place you got attitude. You know, people who quit drinking, people who lose weight, they think they're better than the people that couldn't. And because you got out of the projects, you think that anybody who didn't is weak and stupid.
I'm not judging you. Take a breath.
The only difference between me and you is that I made some bad decisions, and you made some good ones.
You make bad decisions every day of your life. Stop doing drugs, stop having fun, go back to school and get your GED.
Yeah, where's the money coming from? The system's not set up for people like me. What are you staring at?
Your eyes. There's yellow in the sclera.
Fatigue, hair loss, possibility of damage to the lungs, infertility. All possible side effects of radiation. Why don't you like Dr. Foreman?
He thinks he's better than he is?
How good is he?
I don't know. Can we get back to what's wrong with me?
There's a small possibility of leukemia sometime in the future. Hardly worth mentioning. You can't say that he thinks he's better than he is if you don't know how good he is.
No one's as good as he thinks he is.
I am. Might also get cataracts. Sign here.
I don't know. You're telling me how dangerous this is.
We're saving your life. We're that good. Sign there.
I can't decide.
Would you rather a pencil or a pen? Who's the better James Bond, Sean Connery or Daniel Craig? You see, that's not even a decision.
It's happening again. I can't.
Up her blood thinners, get her down to radiology. The attack will be over in 20 minutes. And she'll want to sign this.
How do you feel?
Weak, sleeping a lot. That's normal after radiation.
Deep breath?
A little queasy, too. When I feel sick to my stomach, I always want vanilla ice cream. It's soothing.
It's best to stick with liquids for now.
Shh. I'm getting a murmur.
Oh, my arm. It's hurting me. Take it off! Take it off! Oh, 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 Hey, how come no mask?
We think you have an infection.
Didn't the radiation work?
Did what it was supposed to do. You're dying.
What do you mean, like things are bad and then someday I'm gonna... How much time? How much time?
We can't know exactly.
A year? Less than a year?
Less than 24 hours.
I don't understand. Why are you saying this to me? You're trying to scare me? Why would you do that?
I'm sorry. It's true.
How bad is this cancer? Yesterday, you thought I had a chance.
You don't have cancer. You came in with an infection. We didn't catch it.
What kind of infection?
Doesn't matter. The radiation was the worst thing we could have done. We destroyed the part of your body that was fighting it off. It spread to your heart.
Then give me drugs. They have drugs for infections?
Antibiotics work with the immune system, but your immune system is non-existent because of the radiation.
If it's my heart, you can get me a new heart. People have heart transplants all the time.
It wouldn't help. Infections everywhere. There's nothing anybody can do. I'm so sorry. We've called your grandparents.
Get the hell away from me! Get out! Get out! Aren't you ever gonna leave?
Yeah. Time of death, 3:35. Do whatever you want.
That's how it's gonna be. If you ever really wanna get lost, so maybe it gets quiet. Maybe it gets numb. At least then there's still something to share with someone. Follow the leader.
I got your consent.
Her bra hook.
What?
She scratched herself with her bra hook. That's how the infection got in. Staph aureus.
She died from a simple staph infection?
That and some bad decisions.
What do we got? Nathan Clay, 58-year-old male, peds versus auto. GCS 12, vital stable, gross deformity to the left upper arm.
Right in here.
Complains of chest and back pains.
Mr. Clay, can you hear me? Mr. Clay? On my count, 1, 2, 3. Airway's intact. Breath sounds clear bilaterally. Ow! Tenderness in the left chest and thoracic spine. What happened here?
He's walking with his wife on Michigan Avenue, suddenly flips out, starts wailing on her. A couple Samaritans jump in to help out. He takes off right into traffic. Score 1 for karma.
12 lead EKGs, chest x-rays, CT of the chest, abdomen, and pelvis with recons of the TLS spine.
On it. No, leave me alone. I'm fine.
Laura Clay, 55-year-old female,
I'm fine.
GCS
I need to get to my
15.
husband.
Oh, ma'am. Okay.
Heart rate's tachycardia. This is all my fault. Look, I blocked my fall with my hand, not my C-spine. I'm neurologically intact.
Technical, are you a doctor?
Yes, I am.
Dr. Rose!
Please,
honey,
ma'am,
no,
stay right there.
I'm right here.
Hold on.
There are too many of them.
I'm here, my love.
I need restraints, 2 of Versed, 5 of Haldol.
No, not Haldol, quetiapine. He's not abusive. He has Lewy body dementia.
Wait, scratch the Haldol. 25 of quetiapine.
It's all right, my love.
What the hell's Lewy body?
Debilitating form of dementia. Alzheimer's meets Parkinson's.
In the beginning, I wanted to think it would pass. Any wife would, but I'm also a neurologist, and I couldn't ignore his symptoms.
Oh, so you diagnosed the Lewy body dementia?
Yes, but I got a second and third opinions, and they both agreed it was LBD, and that was about 4 years ago.
4 years? Really? You know, Nathan expressed deep regret to me about the pain that he's caused you. That kind of insight is rare for somebody who's been battling LBD for that long.
Well, my husband was an engineer, and his brain is wired to solve problems. Last year, I retired early. I wanted to devote more time to his cognitive therapy.
Well, it's been working.
There's moments when he's lucid, but more and more is this.
Mrs. Clay, Nathan's latest EKG is still normal. I want to do another one in a few hours, but if it is good too, I'll discharge him.
Thank you, doctor. I know that it would be better and safer for the both of us if Nathan went to a care facility. But if I do that, then it's over. I'm not ready to give up our Sundays listening to opera. I know it's hard to imagine, but my Nathan is still in there. Last week, he made me dinner. Florentine lasagna.
He can still cook?
Well, meals take longer to prepare than they used to. But he does it for me. He's fighting just as hard as I am. Okay, honey, 8 across. It's 5 letters, and the clue is rental agreement, and the first letter is L. I'm thinking the second is E.
L. E. Lease.
Good, good, honey. All right, next one. We're gonna do 23 down, 6 letters. The clue is collects with an S.
What happened?
I don't know. His blood pressure tanked.
All right, bag and hang a lead of bolus.
Yes, doctor. Sets are dropping. Intubate?
Yep.
Grab the bag and hook it up to the O2.
All right, 20 etomidate, 100 is sucks. Let's bring in the fast scan. April, give me some pressure.
Here, doctor.
And I'm in.
Got it.
Okay, scan.
Here you go. Heart rate 110.
All right, belly's clean. Poor wall motion of the LV, and a small effusion.
He's bleeding internally?
Dr. Charles.
Mrs. Clay, please.
Stats are back up. Oxygenation improving.
It's not gonna matter if he goes into cardiac arrest. CT of the heart and great vessels. Let's get him ready to go.
Cath lab for a cardioangiogram?
Should give a better view of Nathan's pseudoaneurysm and hopefully help me estimate a timeline for his wife.
You mind grabbing me an MRI of his head while you're up there?
Brain scan. His injuries don't necessitate it.
Not for him, it's for me.
Dr. Charles.
Dr. Rhodes. His awareness and gross motor skills are just too strong for somebody who's been battling LBD as long as he has. No amount of cognitive therapy in the world is going to outthink this disease to the degree that he appears to be.
Laura and 2 other neurologists have all agreed on the Lewy body diagnosis. You think they're wrong?
I don't know what to think. That's why I need the scan.
I need the wife's consent.
Hasn't she been through enough? I'm just trying to spare her some false hope here.
Hello.
Gentlemen?
Jaco Day isn't exactly the time to be sneaking in unauthorized tests.
I don't know what to tell you.
Okay.
Thanks, pal.
I don't understand. There should be atrophy, heavy degeneration, tangled cells in the white matter. When was this taken?
About an hour ago. I'm sorry, I had a hunch. I rushed it. I really should have.
That is a healthy brain. There's no disease. This means that
Nathan doesn't have Lewy body dementia.
he has the symptoms. Keeps getting worse, practically a textbook case. How?
Take a look at this cross-section we took during the MRI. And notice the adenoma, benign tumor, in the parathyroid gland.
So you think this is all hormonal irregularity?
Elevated parathyroid hormone is consistent with increased calcium and cognitive impairment. Nathan has both.
Yes, but he also has hallucinations, physical aggression. You don't see that in patients with hyperparathyroidism.
That's where his recent bypass surgery makes him unique, okay? The beta blocker he's been taking ever since causes increased levels of violent behavior in a select amount of patients.
Oh my God. A hormonal imbalance with a medication side effect. Why didn't I see that? The clues were right in front of me.
Because they mimic the symptoms of Lewy body dementia to a T. And 4 years ago, that adenoma would have been so small, no scan could have caught it. Look, I'm just telling you that presented with the same evidence, I would have done exactly the same thing, reached exactly the same diagnosis. Anybody would have.
You didn't. I did. And if I had caught the PTH 4 years ago, Nathan doesn't run into traffic, doesn't get hit by a car. Today never happens. He's dying, and it's entirely my fault.
How's he doing?
Well,
Good. How are you doing?
as a neurologist, Lewy body dementia was my worst nightmare. I'd seen so many cases, and I'm wondering if it influenced my diagnosis.
Medicine. You know, imperfect science, practiced by human beings, no less.
4 years, we could have been doing CTs. But I had an answer, so there was no reason to continue radiating his brain. I robbed Nathan of his mind, imprisoned him. I drained our savings, squandered our time together, time that we can never get back. How am I going to tell him what I've done? He's never going to forgive me.
Your husband's gonna forgive you, Laura. I want you to trust me on that. Your struggle, if I may, is figuring out how you're gonna forgive yourself.